Good morning, this is Kavan Peterson with Changing Aging. I'm just going to do a quick video chat with Dr. Bill Thomas to catch up on some of the headlines from today. Hey, good morning.
David.
Good morning, Bill. How's it going?
Great. Excellent. Having a good week.
Good. First, I'm going to just show readers. There's a pretty cool conference going on in Georgia for the past 3 days, sponsored by the organization Environments for Aging. And the cool thing that I think Changing Aging readers will be interested in is that culture change has just been the theme throughout this whole conference.
So I'm glad to see that the conference on design is picking up culture change. I think that the two things go together. When culture change is when we create a system that flexes to meet the needs of the individual. So it's person-centered or person-directed. So in the customary practice, people have to conform to the institution. In culture change, the institution conforms to meet the needs of the person. And that's what's going on here with this design program, is that people are talking about how they could do design that responds to the needs of the individual. And one of the really important places where culture change needs to be seen is in design. And it's not just long-term care or senior housing. We need to see culture change in the design of hospitals and emergency rooms, inpatient care units, everywhere.
Environmentsforaging.com. And the cool thing is that I have a live Twitter feed, and if you get a chance today, you can actually keep up on some of the sessions live. There are two major pieces of congressional legislation that have anniversaries this week, and a lot of people are blogging about these. The first one is the Affordable Health Care Act.
The Affordable Care Act has just begun to unfold. I mean, we had the passage of the legislation, and now we've got some of the pieces beginning to come into effect. So with 1 year into it, I think we're just starting to get to the good parts. And honestly, and I've said this to audiences around the country, I think that the Affordable Care Act is going to turn out to be very good for older people. We already have what you might call universal health care for people over 65. And I think this legislation tries to extend access to health care to people of all ages. And that's good for older people.
The other piece of legislation is the Elder Justice Act. And what folks are talking about with this first year anniversary is the fact that Congress has failed to fund this piece of legislation.
Investigating and taking action against the kind of abuse that takes place in the shadows, where almost all elder abuse takes place, that takes resources. I would really encourage the Congress to put some proper resources here so that elder abuse and neglect can be investigated and responded to properly, because otherwise nothing's going to change. In fact, the demography says the problem's going to get worse.
Great. Alrighty. Well, those are the headlines from today. I want to thank you for taking a minute to chat.
Yep. Hey, I'll see you in the blogosphere.
All right. Have a good one, Bill.
All right. Later. Bye-bye.